Continue with the rheumatoid arthritis drugs. The next class of drug that I am going to discuss is tumor necrosis factor alpha blocking agents. So normally, before going into the drug, I'll tell tumor necrosis factor is normally cytokines. Okay, and this cytokines is normally responsible for causing inflammation. Cytokines, which is normally responsible for producing inflammation, and this cytokines is normally produced by macrophages. It's produced by macrophages and by activated T cells. Activated T cells. Okay, so normally here what happens is this TNF alpha binds to TNF receptor. TNF alpha bind to TNF receptor, and this normally causes release of cytokines. Okay, so when you give the drug, this drug blocks this. It blocks the tumor necrosis factor. So this tumor necrosis factor cannot bind to the TNF receptor, so there won't be release of cytokines, which is normally responsible for causing the process of inflammation. Okay, so in this I have given various classes of drugs, so I'll discuss the important drugs under this class. The first drug is infliximab. Infliximab. Okay, so this infliximab, it is a monoclonal antibody. It's a monoclonal antibody which binds with TNF alpha with high affinity. Okay, so normally this drug is most commonly given in combination with methotrexate. The reason is when you given along with combination with methotrexate, it slows the progression. Okay, that means the severity of rheumatoid arthritis is normally reduced when the drug is given in combination. Okay, so this drug is most commonly given by IV route in the dose of 3 to 5 mg per kg every 8 hours. Okay, adverse effect, increased susceptibility to respiratory tract infection, okay, especially tuberculosis, nausea, cough, headache, sinusitis, skin rashes, and allergic reactions. Okay, so normally, as I told, it is given in combination along with methotrexate. Okay, so normally, in addition to rheumatoid arthritis, okay, it is also used in case of ankylosing spondylitis, psoriasis. Okay, it is a skin disease. Then it is used in Crohn's disease, okay, which is a type of this gastric ulcer. Okay, that is okay. Then it is also used in treatment of ulcerative colitis. Okay, so this is the use of infliximab. The next drug under this class is etanercept. Okay, so this etanercept, it is obtained from recombinant fusion protein, recombinant fusion protein. Okay, and this normally binds to tumor necrosis factor alpha. Okay, but this drug is given by subcutaneous route. So whereas infliximab it is normally given by IV route, this is given by subcutaneous route, where it slows the progression of disease. Slows the progression of disease. Okay, so uses as usual, it is used in rheumatoid arthritis as well as in the treatment of psoriasis. Okay, so this drug is also given in combination with methotrexate. Okay, adverse effect of this drug is it causes pain, itching, allergic reactions, pain, itching, allergic reactions. Okay, so normally wherever you inject at that particular site, it normally shows this major effect. Okay, so the next drug under this class is adalimumab. Adalimumab. Okay, so this adalimumab, it is obtained by monoclonal antibody. It's obtained by monoclonal antibody, and this drug is same as infliximab. The drug is similar to infliximab. Okay, but this is given by subcutaneous route, 40 mg per week. 40 mg per week. Again, this drug is also given in combination with that of methotrexate. Okay. The next drug is satralizumab. Satralizumab. So this satralizumab, it is an anti-TNF alpha antibody. Anti-TNF alpha body, which neutralizes TNF alpha. It neutralizes TNF alpha. Okay, so this drug is also given by subcutaneous route every 2 to 4 weeks. Okay, so either with the methotrexate or it can be given as a individual drug. Okay, so these are the drugs that comes under tumor necrosis factor alpha blocking agents. Okay, so remaining drugs I'll be discussing in the next video.